Hi, my name is JP Hong. Today I would like to share with you a very unique case that was published in Archives of Plastic Surgery, APS. The authors are Giorgio Paftanis, Alexandros Vis, Dimitri Reis, Amir Sadri, Rezi Alamuti, Simon Myers, and Parviz Sadim. And the title is Recycling of Flap Pedicle in Complex Lower Extremity Reconstruction, a proof of free muscle flap neovascularization. So what the authors talk about is a case where they did a free flap, a latissimus dorsi muscle free flap with a skin graft for a leg trauma. In this case, due to the lack of the vessels, they had to use a vein graft in order to approach the superficial femoral artery to the flap. Unfortunately, this patient, after 7 years of surgery, had a chronic osteomyelitis, and the authors had to basically debride, and when the bone exposed, had to consider a free flap. Now, having had a chronic infection, there was a lack of recipients, and they were worried. So they took the CT angiogram, and they found that the previous pedicle, which did a vein graft to the LD, was very visible according to the preoperative CT angiogram. And they plan to use the previous pedicle going into the latissimus dorsi muscle as the main source to hook up their anterolateral thigh after almost a decade of reconstruction. The flap was elevated and the reconstruction was very successful based on the previous pedicle for the AB, which was the vein graft. The authors note that there's a lot of neovascularization during this process, and hence using the pedicle was safe enough to not only sustain the vascularity of the previous flap, but also to allow new circulation to the anterolateral thigh. This is a very good example and a little bit of a variant to a recycled flap. Basically, a recycled flap is a flap that is taken from a previous flap based on the recipient, taken as a new flap and do the reconstruction. But here, they recycled this concept by recycling the pedicle of the previous flap and using that as a recipient. And that's why this was a very unique case. Now, the takeaway from this, as I see it, is that when you're in trouble and when you have done previous reconstruction and the recipient vessel options are not numerous, this is a good way to find and reuse, recycle the previous recipient vessel and do the new flap and achieve good results for complex reconstruction. I would like to congratulate the authors for their wonderful case, and I look forward to seeing more cases from you, all the readers around the world, to be published in Archives of Plastic Surgery. With that, thank you very much.